oral communications. I'm sure you've heard stories about schizophrenia, but do you really know what it is? According to the National Institute of Health, 1.1% of people are diagnosed with schizophrenia, meaning that 1 in every 100 people that you know could have the disorder. In both psychology and AP psychology, I've learned a lot about this disabling mental disorder. Today, I'm going to teach you about the rare but dysfunctional disorder, schizophrenia, by telling you a little bit about the causes, warning signs, symptoms, and treatment of it. Research shows that schizophrenia may have multiple possible causes. One of the causes is genetics. Having a history of family diagnosis greatly increases the risk of having it. According to Meyer's AP Psychology book, schizophrenia occurs in 10% of people who have a first-degree family member with schizophrenia, like a parent or a sibling. In fact, when a twin is diagnosed with schizophrenia, the uninfected twin has a 50% chance of developing the disorder. Another cause of schizophrenia is environmental influences. Being exposed to viruses before birth increases the risk of developing schizophrenia. Also, being exposed to malnutrition before birth gives people a predisposition to the disorder. Lastly, inflammation or autoimmune diseases can impact your chance of developing schizophrenia. The chemistry and structure of the brain also have a big influence on people's chances of getting schizophrenia. For example, an imbalance in the brain chemistry, like you can see in this picture, and interrelated chemical reactions of the brain involving dopamine or glutamate play a role in schizophrenia. Experts also believe that problems during brain development before birth, which lead to faulty connections, could also be a leading cause of schizophrenia. Since the brain goes through major changes during puberty, psychotic symptoms can be triggered during this period, leading to schizophrenia. Those who use drugs during this critical period of change in the brain during teen years have a higher predisposition to developing schizophrenia. Since a lot of the causes of schizophrenia occur before birth or without people being aware, there are warning signs of developing this disorder that everyone should be aware of. One category of warning signs are the physical signs. Signs of developing schizophrenia are normally seen between ages 16 and 30, according to the chapter labeled Schizophrenia in Barron's AP Psychology book. If you suspect that someone you know has schizophrenia, the easiest kinds of signs to detect on them are the physical signs, which are seen through observation. A big sign you can see through observation is overly acute senses. Overly acute senses are seen when someone's senses are too sensitive. For example, when lights seem too bright or when noises seem too loud to someone. Sleep disturbances are very common too. If you notice someone sleeping either much more or much less than they normally do, you may want to look into it. You can also observe changes in people's mood. For example, if someone who used to have a lot of passion now seems desireless or cannot find pleasure in anything they do, that should be a red flag to you. Severe anxiety and sudden irritability in people who are normally very calm and laid back should also catch your attention. Now on to symptoms of schizophrenia. The symptoms are divided into two main groups, positive and negative symptoms. Positive symptoms are psychotic behaviors that are not generally seen in healthy people, but are seen in patients with schizophrenia. People with positive symptoms may seem to have lost touch with reality. Hallucinations and delusions are both symptoms, and although they are not the same thing, they both involve hearing or seeing things that are not actually present. Thought disorders are common too, which is an unusual or dysfunctional way of thinking. Movement disorders, like agitated body movements, are also common. Negative symptoms are obviously the opposite of positive ones. They are disruptions in normal behaviors and emotions in healthy people that are not present in schizophrenic patients. This includes the flat effect, which is when you show a reduced expression of emotions. Difficulty beginning activity is common, and if they do begin activity, they may have a hard time sustaining the activity. Although there is no cure for schizophrenia, it can be treated, which will cause the symptoms to show up less and to be less severe. One kind of treatment is antipsychotics. Antipsychotics are a form of treatment which are medications that are normally taken daily in pill or liquid form. A newer form of antipsychotics are injections taken only once or twice a month, depending on the patient. Some patients do not take their medications because they get bad side effects, but those side effects go away within a week or two of taking it. Doctors and patients work together to find the best medication or combination of medications and the right dose of them. Schizophrenia can be treated also through therapy. Psychosocial treatments are a type of therapy that takes place after you have found what medication works best for you. This therapy involves learning and using coping skills to address the everyday challenges of schizophrenia. It helps people in pursuing their life goals, such as going to school or getting a job. Patients who attend psychosocial treatments once a week are less likely to relapse or to be hospitalized. Those are the two main treatments of schizophrenia, and research also shows that they have the best result and that they work best together. Today you probably learned a lot about schizophrenia that you never knew, like the causes, signs, symptoms, and treatment of the disorder. Now if you have your suspicions of someone who's close to you, or if you're questioning yourself, you know how to approach it and what kinds of signs to look for. Just remember, although it is a serious disorder, only 1.1% people have it, meaning that if you do see these symptoms in yourself or in other people, chances are the symptoms are just caused by stress and not by this disabling mental disorder.
10 out of 10.